The COVID-19 pandemic has affected the lives of nearly everyone in the United States, but it has been especially difficult with people suffering with their mental health. According to a national report from NPR, eating disorders are thriving during the pandemic. Hotline calls to the National Eating Disorders Association are up 70 to 80% in recent months. Tonight, I'm joined by Dr. Stephanie Waite. She's a licensed professional counselor who has battled an eating disorder issues herself. Thank you so much for joining us tonight, Dr. Waite. First, tell me how stress linked to the pandemic is affecting people with eating disorders.
Thank you for talking about this because it's something that I'm really passionate about. So I'm glad to hear us talking about this because I think the pandemic is affecting people right now. What's happened is people have lost a lot of their support. We're finding people needing to maybe go into a higher level of care. It's harder to get into those programs just because of, COVID, like safety policies and social distancing. So they've lost support. We're hearing that folks are everyone is more anxious and more overwhelmed. And when you don't have your support and you're anxious and overwhelmed, it feels really hard to be battling with an eating disorder because it's something that I think a lot of people don't talk about, and it's hard to talk to support. So people struggle alone right now.
Right. And I mean, with working from home, especially during this pandemic, talk to me about how big of an impact maybe that's had.
At home, I'm hearing this a lot from folks. It kind of feels like they're trapped inside and all they can think about is food, whatever that looks like for your eating disorder. The food is calling, and there's not a lot of distraction. There's not a lot of tools or, again, people to help turn that off. So we're stuck inside with thoughts of food all day.
And Dr. Waite, I'm sure that you know this, telehealth visits are at an all-time high. Is this a good way in your mind for people struggling to get some help?
Absolutely. I've seen so many more people able to access care. There aren't a lot of people who can treat eating disorders, who specialize in treating eating disorders. And so a lot of people don't have access to care. And as I was talking about treatment programs, right? So a lot of people don't have, their therapist isn't as available. The person they can talk to isn't as available. So they are able to access support through video and telehealth options. And I've seen so many more people who couldn't get help before, I think are able to get help now.
And do you have any tips for parents to spot eating disorders in their teens, and how could they help?
Great question. Thank you for asking that. Parents, a lot of teens and young kids are isolating. And so how much of is your kid getting out and eating, or are they hiding or sneaking food? How much are they exercising? They can do those things alone in their room. So how much of some of these things are they trying to do behind our backs or doing in a way that it's not as obvious as just sitting down or not sitting down at the dinner table? I think we have to look at food behaviors in between meals and what our kid is saying about food and what our kid is saying about their body. If they're wanting to diet and lose weight, that's usually a pretty big red flag.
Well, so many components there. Dr. Waite, thank you so much for joining us tonight. We appreciate your time.
Yes, thank you for having me.
Alrighty, thank you.